A very good evening to you. Thank you so much for keeping it tuned on Oracle TV. Thank you for loving us, and thank you so much for being together with us kuanzia pale asubuhi mpaka saa hizi, and I hope that which uliweka pale kwa kujiambia kwa diary, this is what I want to accomplish today, you've been able to accomplish it. And now you know it's that time, it's that hour. We are here to get informed. We are here to relearn some things, learn some things, and learn some things. And that is why I make sure I bring you specialists so that they can answer you that burning question, that intense question that we've been having, and relive kwa reality. You know, most of us live in that nitaitaje, kuna fiction, kuna ile mambo yenye tunataka tujiaminie, our own truth, but I bring you the facts on the table so that you do not make that mistake, and also you know what you're supposed to be doing at what time. And if you're told to do 1, 2, 3, why is it important for you to follow that until the end of it? Ukisikia vizuri si ati unawacha sababu unasema jana nilikuwa nasikia weak, but now I am strong, let me leave the medicines. And that is why I make sure I bring you best of the best on this TV, on this platform. Ndio usitafute kwingine. As always we say, we bring you the balance diet meal. Of course, this is the Health Desk, your direct line to your medical doctor, with me, Trevilla Lutta, and today we are in for a good. When I say good, we are in for a good course. We want to talk about the medication mistakes that most people make without knowing, and others si kupenda kwao. Tunataka tu tuwakumbushe ni ile maybe unakuwa uko na mambo mingi hapa na pale, and that is why we are here to make you know what you're doing is a mistake and you should rectify it. Maybe umekuwa ukiona kama ni normal, umeona watu wengine wakifanya, umezaliwa ukakuwa ikifanyika, and you decided let me continue with it, and that is why we are here to tell you stop. This is the way for you to go, and this is how you're supposed to be doing 1, 2, 3. But before I continue, I have a guest. Siko peke yangu, unajua mimi naweza kuambia nitakwambia hizi no, but I bring you somebody who has gone to school, has studied, and the person is also practicing it, is doing it on a daily basis. Akuelezee what are the facts of doing this and this, what is the wrong in doing this and this, and why should you keep on doing 1, 2, 3. But before we dive into it, acha nikaribishe mgeni wangu ajiintroduce, akwambia utampata wapi na napatikananga wapi, siku gani. Unajua kuna wale wako na masiku na masaa utanitafuta hii masaa na nini, so that is why I want to yeye mwenyewe ajiintroduce, akwambia utampata wapi na siku gani. Karibu sana daktari.
Thank you very much, Trevilla, for this opportunity.
Karibu.
My name is Dr.Muraran, a pharmacist by profession. And I have a private practice at Naka Center. My facility is called Vienova Clinic. We offer services from general consultation. We have lab services. We have the pharmacy services. I also have worked in the government for over 20 years. So in the pharmacy industry, I am very well conversant. And you're welcome to come to our facility at Naka Center anytime. We are open 24 hours, so we are fully there. We have staff, we have the right medication, we have accurate lab results. Karibuni sana.
Oh, so mtu akikuja anatarajia kupata, are we supposed to get the normal that we find in other hospitals, ama tukikuja kuna specific things that will get there yenye tuwezi pata mahali kwingine?
At the moment, we are very new, by the way. If you've noticed, Nakuru, we have very few hospitals.
Yeah.
There is lack of hospital in Nakuru. There are very few. We are very new. We are expanding. So at the moment, we are doing the basics. But as we grow, we are growing. We want to grow with our clientele. So karibuni, we grow together. I want people to come, we grow together.
Oh, so the services, if you can kindly mention the few services that you can get.
Okay. Now we have, when you come to general consultation, there's physical examination, there's cancer screening, which is very important at the moment. We're doing cancer screening, and then we have contraceptive counseling. When you go to the lab, tukona all the lab equipments, including Zafulim, biochemistry, And the pharmacy is well equipped. Our pharmacy, hautakosa dawa kwa pharmacy yetu. And we have very affordable prices.
Hapo sana.
Nikikwambia I've worked in the pharmacy field for over 20 years, I will not disappoint when it comes to the pharmacy. Our pharmacy is fully equipped, and our prices tutashindana na wale watu wa town, wholesalers.
Wow.
Yes.
Wow. Now you have if you're in Nakuru, make your way pale. Usingoje kuambiwa, make your way. Where exactly are you located?
Naka Center. Ukiwa tu Naka Center. If you ask for Vienova, we are well seen. It is well branded. So if you just ask for Vienova, you'll be directed.
Wow.
Yes.
So ukiwa pale uko Nakuru, please make your way. And if you're in Naka, if you're in these areas of 58, find your way to Vienova and you'll get whatever the doctor is telling you. Go there, get checked, get screened. Tuli agree, fanya ile check-up ikuwe routine. Because nowadays we are living in a world where unalala leo uko hivi kesho, something else in a hit, unasikia sijui, but ukiwa na ile tendency of being checked every now and then, you'll know how well your body is. Kukiwa na kachange kadogo, it will be easy for you to get to understand what is really happening to myself. Lakini kama hujazoea kujiangalia hata upate nini, you will not know. And we said health is the first key. Trust you me, health. Kama una health mzuri, hata upate mali kiasi gani, you'll never enjoy your wealth. You will never enjoy that wealth. And for us, we want for you to work. Unajua Biblia ilisema kazi ya mkono yako. Unajua kazi ya mkono yako inakubariki, unapata pesa, na also the Bible say you should enjoy. So pale kwa enjoyment ndio health inakujia. For you to enjoy your wealth, make sure you are healthy, get checked. Go there, see the doctor. Daktari pale tukienda atatuambia kama kuna discount. Ukienda atakuwa anakuambia kama utapata discount ukienda usio, kwa sababu you're our family, so lazima akupatie ka discount kidogo. So stay tuned, usikie ni discount gani daktari atakuwa anakupatia. So daktari, to start us off, there's this tendency of people knowing we do not know what is being prescribed medication by a doctor, and also dispensing medicine by a pharmacist. What is the difference?
Now, this is the difference between prescription and dispensing. Kazi ya daktari ni prescribe. You will tell the doctor, you give a history to the doctor. The doctor has, wakienda shule, wanafunzwa. Your history taking, they will be taught how to take that history, and the symptoms, the signs, everything. From that, they gauge what conditions you might be going through. Sometimes they'll send you to the lab. Sometimes they do it clinically. They can see the symptoms and just decide, this one is this condition. That is when they write a prescription for you. Then, dispensing ni pale pharmacy. Pharmacy, sasa ukipeleka your prescription. Dispensing is the act of giving out the medication. And one funny thing, this is how medical school is related.
Okay.
When you're giving the doctor your history, the pharmacist was not there. But when I get your prescription, I'm easily able to know what condition you have.
Oh.
That is how funny it is.
So there's connection between a doctor and a pharmacist.
So sometimes we even have a disconnect when I cannot figure out what the doctor is trying to treat. Hapo ndio unajuanga kuna shida mahali. Lakini nikishika prescription hivi, na si kukua kwa hiyo room, and I know what condition I'm treating, it shows we are flowing in the right direction. So usually prescribing ni kazi ya daktari, dispensing ni kazi ya pharmacist. Yes.
Wow. Now we know the difference. And why is it important for people not to ignore side effects of a medicine?
Side effects of a medicine. Kwanza, side effects of, especially if you are taking 1 or 2 medications, kindly ask in the pharmacy, are there any side effects? Should I take with food, after food, before food? Are there any food I should avoid? Those are the questions you should ask. Usually in the pharmacy, we try as much as possible to write them. Lakini sometimes unapatanga workload ni mingi sana, mtu anaandika 1 times 3.
Yeah.
I know that is on us. Lakini, we are supposed to write 3 times a day after every 8 hours. And we say either after food, before food. Yes.
Oh, so it is important to know if you're supposed to be taking this meal before or after.
Yes, exactly. It is some of the active ingredients react with food. Some cannot break down when there is food in the stomach. So we will tell you take it before food. Yes.
For it to work.
For it to work best. But sometimes, kwa sababu sisi hatumesahau kuandika, you will take it, so unakuja after 3 days, you're saying, daktari ile dawa haikufanya kazi, but it is the instructions hapo kwa pharmacy ile ulikosa kidogo. Yes.
And there's this tendency, I've gone to see the doctor has prescribed, the pharmacist has dispensed the medicine. Now I've started taking the medicine, I am feeling better. Kabisa ile nguvu sikuwa nayo, it has started coming back, naona appetite ndio imerudi. So I stop taking this medicine. What is the danger of that, actually, when it comes also to antibiotics?
Now, and we'll start by saying, to get one molecule of a drug, let's say amoxicillin, the research that is put in that drug, for it to be approved that it can work for a human being, it takes over 10 years.
Wow.
One drug.
One drug.
It takes over 10 years. Umekuja, umepewa amoxicillin. The pharmacy has dispensed amoxicillin in the right way. You have gone home after 2 days. You have felt better and you're thinking, why should I finish the 5-day dose? What you're doing is you're exposing the bacteria to the molecule. But you're exposing the weakest bacteria to the molecule in that 2 days. The first thing the molecule does is to attack the weakest bacteria. The strong bacteria are left. What happens? They mutate. They say, oh, this person, this is the antibiotic they'll be exposing us to. So meyacha at 2 days,
yes,
it mutates, it becomes stronger. Next time when you come, that amoxicillin will not work. That's why even in November, we had something called the Antimicrobial Resistance Week. We are trying to tell people, if it is not necessary to have an antibiotic, kindly do not have it. And if you're having an antibiotic, kindly finish the dosage. It is as simple as that. Yes, there's no need we risk. Very soon, you'll get admitted for other conditions. Na tumekuexpose. Sasa ulikuja tukakupea amoxicillin, ukakunywa 2 days. So the next time you come, you tell me, Daktari, amoxicillin no longer works for me. I'll give you cefuroxime, which is a higher class. You take it for 2 days, you feel better. The next time you come, I'll give you something higher. If by any chance you go to hospital and you're admitted, there is no medication that will work for you because we exposed you to small doses of antibiotics.
Oh, so there's a problem of you taking small portion of it.
Yes, you're creating resistance for yourself. So eventually there's nothing that will be working on your system. Sasa hapo ndio tunaanza kusema,
It's like having a total shutdown on your body.
Yes. So it's usually important. Just finish and stick to may I say, keep it simple. When it comes to antibiotics, the lower you are, the better for you. Usiende hospitali expecting argumenting. Why? Kama kitu simple, Septrin can treat it. Say take Septrin. Yes.
So unajua kuna wale wanapenda, when I see this medicine, I don't just feel nimepona. Daktari nikao nipatie dawa mzuri. Na kwa hiyo tendency, there are people who don't, apart from those who don't finish medicine, kuna wale ambao they will miss. See, it is 1 times 3. So nitajiambia siku asubuhi nitoka na haraka when I was going to work. Of course, at lunchtime, I had workload. So I did not take the medicine. So kifika jioni, since I did not take in the morning and during lunchtime, let me now maliza yote. Let me take 3 at once. What is the danger of that?
That is overdosing yourself. Basically, there is no other way I can tell you. Usually, we say the only time you're allowed to overdose yourself is a start dose. If the doctor sees the infection, the levels of infection in your systems are high, they'll give you either it's called a loading dose. They'll give you maybe 2 tablets start. But going forward, you continue with the same regimen. Sasa wewe, because wewe umedecide kukua daktari wako, you decided you're going to make your own decisions. You decide on day 3, you forgot to swallow lunchtime and in the morning.
Yes.
Trust me, you're doing injustice to your body. You're shutting down. And then our bodies are very funny. You know, they correlate.
Yeah.
The kidneys are the ones which are going to fail the first one because you're loading them. They are the ones that clean our bodies. You're loading them with unnecessary. They'll have to do the cleaning themselves. You're loading. Unajiharibia system for no good reason. Area to wake alarm. Mi usema put an alarm because 3 times that is mbaya. There are medications that come 4 times. You swallow 4 times in a day. When you find me dispensing such medications,
yes,
I even write the time for the patient there. Unameza isa. I even tell them, eka alarm nikiona.
Ndio sisahau.
Yes, I'd rather alarm ikusumbue, useme guy, you run to the nearest chemist hapo na ununue kamoja. Because you forgot.
Yeah.
And continue in the evening. Than saying, I left the other one at home, I've forgotten this one. Don't worry, I'll go and swallow the 4 of them in the evening.
In the evening. It'll cover up.
Apana, you're spoiling your system. You're damaging your system.
Na kuna wale watu ambao, last time nilikuwa na malaria. I was given medicine. Nikapona. So this time, I'm feeling the same symptoms the last time. So it's either I take the leftover of the last medicine, or rather, my friend tells me, I had that symptom. Na kulingana tu na vile nakuona, pia wewe, chukua tu dawa. What is the danger of that?
Those people are in the same group with the people we call Google medical students. You're graduates from Google and relatives. You graduated, you went to Google, you put your symptoms. Your auntie from Kisumu also suffered the same condition, has told you need dawa. Wewe unakuja hata kwa daktari, hata unamwambia mimi najua ni nini na suffer from. Na unajua auntie yangu aliniambia ukinipea hii dawa, this one is the one that is going to work.
Nasema katoni yake ni ya green.
Honestly, there are people who have gone to school. Trust me, these people have gone to school. A minimum of 3 years what were diploma. Wameenda internship a minimum of 1 year. Lakini wewe, because you do not want to trust that they were taught the right thing, you want to Google or you want to depend on your siblings, your relatives. It doesn't work like that. Wewe tu kuja, trust the medic. Go to your clinician. Go to the pharmacist hapo kwa chemist. Umwambie shida yako ni nini. Without, me I usually say, as a medic, even when I go to the hospital, when I take my kids to the hospital, I don't preempt that I'm a medic. I go and I'm a patient at that time. Mimi unyamaza nasikia niambiwe ni nini. Hata kama unajua mtoto wako anasuffer from what. You don't just go and say my kid is suffering from this. I think they need this and this and this. No, I usually sit down there, tell them, daktari, this is what's going on, this is what's going on. Ndio niambiwe acha kunywe hii, acha kunywe. And one funny thing, ukitrust hivyo, your life becomes more smoother. Because them, they don't do it out of, as a parent, I'm doing it out of sympathy and I'm over exaggerating it, but the doctor is a bit rational. Anaangalia anasema hapana, sidhani huyu mtoto karibu anaenda kweli. Pengine tu ni kahoma. Pengine ni kahii. Maybe hata he doesn't need an antibiotic. That's why I'm saying, let's trust our medics. They have gone to school, they have studied. Let's just trust them.
Utuweke imani
hapo mua trust tu.
Because tuliambiwa kila mtu aliyeko, kwa sababu sisi wote tungekuwa madaktari. Sisi wote, that's why they are there. Na kuna hao wenye wako na tendency ya they are mixing painkiller. Anaona painkiller inside. Wacha niende herbal medicine. Anachukua herbal medicine kidogo, anaka supplements. This person is mixing in a span of them maybe going to the doctor and being prescribed the right medicine. They still go to the herbal medicine. They still actually diagnose themselves also. Pia wanajiongezea madawa. What is the risk, danger of them doing this? And of course, what worries you the most in this case?
And I would say toxicity. But let me start by saying, wow, naitwanga combination scientists. Hao ni watu wako, hao ni combination wanajua mwarubaini ukimix na hii na hii na hii. Let me now be honest. Herbal remedies work. They do. But the problem is when you mix it with pharmaceutical remedies. Pharmaceutical remedies also work. But, you know, most of the time we don't know the strength of these herbal remedies. So, hata ukikuja kuniambia and you're doing a herbal remedy, the first thing I'll tell you is give yourself, stop doing that herbal remedy and give yourself time before you start doing the pharmaceutical remedies. Because the toxicity levels that can happen there, tunaweza shindwa kureverse because it is very toxic. What I would tell people is, when you go to a doctor and you've been doing herbal, be honest. Mwambie daktari, mimi nakunywanga mwarubaini ama nakunywanga dawa. In fact, hata kuna watu wanaekanga some other funny things. Be honest and tell the doctor. That way, chances of us intoxicating you will be less. Because we'll have to give time for that, whatever you've been taking, to leave the system before we start ours. But most patients, because unaibika kuenda kuambia daktari ulikuwa umeleta 5 liters kutoka Mogotio ya kukuja kukunywa, unanyamaza, sisi tunakuongezea zetu, inaenda inaharibu the whole system, tunashindwa kwani huyu patient what happened. Munaangalia prognosis hivi, mnashangaa huyu alifika aje hapa.
Kuna wale ambao wanaogopa, maybe the doctor will talk to them rudely.
No. Okay, I know we are a bit harsh. We are a bit harsh, but lazima tuchape kiboko mmoja mbili tukwambia stop it first and then come now and we clean the system and then I come for the pharmaceutical remedies.
So what you're saying is important for you to tell, when you're going to the doctor or to the pharmacist, just be open and honest.
Be honest.
I've been taking this medicine for 5 months, but I'm not seeing any change. And that is why I've opted to come here.
Yes.
So that you can verify for them what and what they're supposed to be doing. And maybe in that case, the instruction that you give, when you're giving a person medicine or a prescribing, the instruction you give. And those instructions may seem small,